Today's presentation is by Dr. Michael Fridman. He will be talking about the history of cardiac morphology and humans behind the hearts. And at the end of the presentation, there are a couple of great stories about these humans from Dr. Benson and Dr. Guerra. Michael was born and raised in Toronto, and he completed his medical residency and his core cardiology fellowship here at the Hospital for Sick Children. He has always had an interest in rhythms and is the current electrophysiology fellow for this year at Sick Kids. Thank you very much, Michael, for presenting.
So thank you very much, everyone, for allowing me to speak and allowing me to have an opportunity to talk about some of these fascinating figures in our specialty's history. So for the next 20 minutes or so, I want to talk a little bit about the humans behind the hearts, or the folks who founded the field of form. And to begin, I want to give a bit of a disclosure. As with every University of Toronto and Sick Kids lecture, we should talk about any conflicts of interest. And I can say I wish my life was interesting enough that I had a conflict of interest, so nothing to worry about there. But I also want to acknowledge that there are a lot of people to talk about in congenital heart disease morphology. And because of the time constraints of the presentation, I couldn't get into everyone, and there will certainly be people that I've left out that are fundamentally important to the field. And that's not intended as a slight, and it's not intended to do anything or comment in any way on their contributions to our field, just acknowledging the time constraints. As well, I'd like to provide a special thanks in advance to Doctors Benson, Chasen, Seed, and Yu, who provided some guidance and input on some of the morphologists, anatomists, and clinicians that I'll be discussing in the next for the next short while. So in the beginning, let's talk a little bit about morphology. Morphology is described as the field of study of shape and form, and it's something that humanity has always seemed to have done in one form or another, with documentation of human anatomical drawings as far back as ancient Egypt. And while it would be wonderful to be able to ascribe some degree of divinity to the field through the likes of Anubis and Osiris and Ra, the reality is far more human, but that doesn't make it any less exceptional. Somewhat like this Sesame Street rendition of the famous Rembrandt painting of the anatomy lesson of Dr. Nicholas Tulp. And for those of you who haven't seen this painting, this is an example of what 16th century medical education would have looked like, with operating theaters, anatomical theaters, and sessions where the anatomists and morphologists go through the different structures within the human body. This patient, for example, has an arm that's been attached upside down, which says a little bit about Rembrandt's proportions from an anatomical perspective, even though from a painting perspective, he's done an outstanding job. But to bring things into a bit more of a modern context, as we talk about the idea of moving things through the ages, we see how the different influences from the past dictate a lot of the fields moving forward, and that's no different now than ever before. So looking to those ancient inspirations that started the journey of morphology, there are several major manuscripts that have been discovered over the years, several of which have described cardiovascular anatomy in fairly robust detail. The first manuscript on the left of the screen is the Edwin Smith Papyrus, and it's dated back to the 1600 BCE. And in this papyrus, this is the oldest known surgical treatise on trauma, and it's described 48 different cases of injuries, fractures, wounds, dislocations, and tumors. And it's the first documentation of knowledge of the heart as a functional organ, not just a solid crystalline structure within the body that is influenced by and influencing the humors. And as well that it had blood vessels that connected to the different parts of the body. A papyrus, I suppose, dated 50 years later, called the Ebers Papyrus, is a 110-page document that covers many topics of medicine, including a treatise specifically on the heart, noting that the heart is the center of blood supply, with vessels attached for every single part of the human body, acknowledging that the life bloods pumping through people must therefore go through the heart. In this text as well, it emphasizes the role of the heart as the core of the body, a concept that's referred to as cardiocentrism. And that's the belief that the heart is the main controller of sensation, thought, and body movement. And although this metaphor extends today into Hallmark movies and Valentine's Day advertisements, we all know a little bit better. And cephalocentrism came about, introduced by Pythagoras, the man with the triangle in the top left of the screen. In the top left of the screen. And in 550 BCE, it was reaffirmed by Plato in the top right, Hippocrates in the bottom left. And as you can see in his interview with, I'm forgetting his name right now, but one of the late night talk show hosts, you can see Galen sitting there recounting everyone about his witty understandings of the world. Of note, in this era, it seems that the only way to really succeed in medicine is to have a particularly excellent beard. And clearly, they didn't have to worry about mask fit testing and COVID-19 and pandemics. So just a hearkening back to a simpler time, I suppose. So to try and give some credit to the forerunners of cardiac morphology, I want to break the timeline down into several simpler chunks. And I acknowledge the fact that these are not real divisions, just something that I've put together for simplicity. The first few will briefly look at the early anatomists and their lives, understanding that there's some overlap with the early clinicians and their discoveries relating the morphology and function to clinical outcomes. Then we'll discuss a little bit about the 20th century physicians, and those are the people who made some of the greatest strides in our field, and then talk a little bit more about the modern era and some of the morphologists that we know a little bit more famously. So we've got color coding for everyone without red-green color blindness. I apologize for those of you who may have. And let's zoom in on some of those anatomists and get started. So the first anatomist of note would be William Harvey. Harvey was an English physician who lived in the 16th and early 17th century, and he was credited with scientifically proving that the body has two parallel circulations, a work that was inspired by the writings of the 13th century Muslim physician Ibn al-Nafis. His key work was the, I'm not going to butcher the Latin, but the anatomical exercise on the motion of the heart and blood in animals, which paved the way for further experimentation in vital organ anatomy and physiology. The second anatomist of note led another interesting life, and this is Niels Stensen, whose name was later Latinized to Nicolas Steno. And he's a Danish scientist who studied under Bartholin and is famous for the discovery of his eponymous salivary duct. But he's also been credited with providing the first recorded, and pardon the pun, true blue description of a stillborn fetus with tetralogy of Fallot 200 years before Etienne Louis Fallot made his initial description. Thus, it was initially referred to as the Steno-Fallot tetralogy. As well as you can see in the portrait that I've selected here, after he became Steno, he became a bishop and was a major member of the Catholic Church in the Netherlands, and eventually was canonized into a saint after his death, making him one of the few physician saints that actually exist. It's also important to note that he's the first person who, through experimentation and modeling and boiling of cow hearts, determined that the heart itself was composed of muscular tissue and springboarded the understanding of the heart as a muscle itself. The next anatomists that I think are important to review are also from the Netherlands in the late 1700s, and that's Edward Sanford and his son Gerard. And they compiled an extraordinary compendium of congenital and genetic anomalies in two distinct volumes. In part ones of their anatomical pathologic observations, they described a case of a 12-year-old blue boy. And after the blue boy passed away, they performed an autopsy and identified morphologic features of tetralogy of Fallot, and they were the first to hypothesize that opening of some of the arterial ducts of the fetal circulation may actually have the ability to lessen cyanosis. And the fact that this boy had a small restrictive patent duct likely facilitated his improved survival over the course of his short life. And finally, no morphology talk would be worth its salt without a brief visit to 1888 to see Etienne Louis Falot. He's described multiple cases of his eponymous tetralogy and noted that 75% of blue patients have some combination of pulmonary stenosis or atresia, an overriding aorta, a VSD, and right ventricular hypertrophy on autopsy. So with the field set by all of these individuals, looking at the hearts of these children who've had unfortunately short lives, stillbirths, or challenging qualities of life because of their cyanosis, they were able to open up the field and move things forward in conjunction with the clinicians that I'm about to describe. So due to the necessary brevity of this talk, again, we'll keep the detail a little bit light, but we'll get a little bit of an understanding of some of the lives of these people and these key figures. So 70 years before Falot, medicine entered a new age thanks to some of the seminal works by René Laennec. In 1819, Laennec developed the stethoscope, which led to a revolutionary change in the field of medicine and the field of cardiology, with the new ability to auscultate murmurs with a greater degree of precision than by simply putting one's ear to a patient's chest. The story of how he discovered the technique is not entirely clear, and there are several possible accounts, but the most convincing was published in a book by Webb in 1928 on Laennec's life. In it, he described a story where Laennec was running through the gardens of the Louvre on the way to a patient who was having significant respiratory distress when he came across, quote, some urchins, end quote, playing in the field, tapping the end of a wooden beam and laughing that they could hear the taps on the far end of this wooden beam. Inspired by this, he ran over to his patient, who happened to be obese, and by putting his ear on the chest, wasn't able to hear anything. Rolled up a piece of paper into a tube, placed the tube against the patient's chest, placed his ear against the tube, and realized that he could discriminate the sounds of the heart and the lungs far better than he could have with his ear alone. Later, in his own memoirs, Laennec recounted that the sound seemed to travel better through wood, leading him to create the solid wooden stethoscope, which would lead to an explosion in medicine and many papers written on the quality of sounds the body produced and how they could be used to diagnose patients and provide guidance into management. Among those that described heart sounds were a few physicians who went on to characterize congenital heart disease and acquired valve disease. Unfortunately, due to time, I won't be able to comment much about rheumatic heart disease, although that's another incredible history for another talk. One of the prominent English clinicians of the 1850s was Thomas Bevel Peacock, and in 1858 he published a comprehensive treatise on heart disease with illustrations focusing primarily on valvular disease. Of note, he was the first to describe the characteristic radiation of the pulmonary stenosis murmur, and his book also included many illustrations on ventricular septal defects, various forms of pulmonary stenosis and valvular pathology, and transposition of the great arteries, amongst many others. A contemporary of Peacock's was Henri-Louis Roget, and he was a French pediatrician, the first pediatrician of the bunch, who in 1874 described the correlation between small restrictive ventricular septal defects found on autopsy and physical examination findings therein. Specifically, he was the one to initially describe the holosystolic VSD murmur, which was aptly referred to as the bruit de Roget. In 1879, 5 years after his characterization of this murmur, after very few cases, he actually correctly determined that individuals with small restrictive VSDs may have these substantial physical exam findings, but will remain asymptomatic. And with this discovery, he actually impacted a tremendous amount of the medical field by showing that a very severe murmur with high thrill may not actually, or high vibration, for those who don't know what a thrill is on physical exam, may not actually require any more advanced interventions and should be expected to live a mostly normal life. Another contemporary was George Alexander Gibson, a Scottish physician who made his mark with auscultation of congenital heart disease. And his specific contribution to the field was the characterization of the murmur and description of the pathophysiology of the patent arterial duct. His published texts include a text on diseases of the heart and the aorta, which were published in 1898 and served as one of the several seminal texts in the field of medicine at the time. So now moving forward and jumping into a new century, we will enter a time where we have two individuals that I want to spend a little bit more time discussing. So I want to talk about now some of the most prominent contributors to the field of pediatric cardiology, and the ones of note in the early to mid 20th century are the so-called mothers of our field. One a Canadian on the right, the other an American on the left. See if you can guess their names. The one on the right is Maud Abbott. And Maud Abbott was a truly remarkable woman. She came from a very difficult childhood and beat the odds of growing up in an impoverished family where her parents actually passed away and was looked after by her grandmother. And she successfully made her way into high school and succeeded with such an extraordinary degree of grades that she went on to apply for a medical education. Unfortunately, at the time, because women were not particularly included in the field of medicine and medical training, she was rejected by McGill University, but went on to another university in Montreal called Bishop's University. And there she completed her medical degree and completed training as a pathologist in Canada, Europe, and the United States. Eventually, she'd be hired by McGill to curate their medical museum, and through her diligence and effort, the museum expanded exponentially during her tenure. And due to her extraordinary expertise, she was asked by Osler to write the congenital heart disease section of his Systems of Medicine compendium, which paved the way for her to publish her magnum opus, which is the Atlas of Congenital Heart Disease in 1938, an incredible textbook of illustrations and descriptions of congenital heart pathology that is still used to this very day. McGill University actually created a brief video series to provide some details and some of their archival footage of her life and her early career. But due to time, I won't be able to show the video, but I encourage you to take a look at this website. It gives some really fascinating information about Dr. Abbott and provides two videos about her early and late career and some of the wonders and challenges that she experienced. She's a fascinating woman. The other woman who's important to mention, who was officially referred to as the founder of pediatric cardiology, and this is Dr. Helen Tausig. She was instrumental in numerous medical events, including the development of the Blalock-Tausig-Thomas shunt, along with Alfred Blalock and Vivian Thomas, and also helped avert a thalidomide crisis in the United States by testifying to the FDA early about the birth defects that had been seen in Europe. So a truly remarkable woman. In her early life, she suffered from dyslexia, but in spite of this, graduated from Harvard Medical School and did advanced training in cardiology and pediatrics before being placed as the head of the Harriet Lane Home, which was the children's cardiac unit, predominantly looking after patients with rheumatic heart disease, but also those with congenital heart disease. Johns Hopkins provided her with a new fluoroscope and an ECG machine, and she became very proficient and prolific in her understanding of heart disease in children using only these simple tools in the physical exam. By the time she finished her training at Hopkins, just prior to starting this profession, she had completely lost her hearing and relied heavily on lip reading and hearing aids for the remainder of her long career. Her major passion was for the blue baby syndrome, and she noted that if the ductus could be closed surgically with a ligation, why couldn't an artificial duct be made? And in doing so, she inspired the Blalock-Tausig-Thomas shunt and was awarded the Lesker Prize for her work. And for anyone who's interested, there's a fabulous film that was created called Something the Lord Made, starring Alan Rickman as Alfred Blalock. And it goes through the discovery process of the Blalock-Tausig-Thomas shunt and has some really incredible historical references. A bit of an artistic license, but a really fabulous film for anyone who's interested in congenital heart disease. So finally, we're going to move into the modern era, and these are names that everyone is going to be familiar with as well. We'll start off with the first morphologist of note, Dr. Maurice Lev. Dr. Lev was considered by most in the field to be a pioneer in the pathology of congenital heart disease and in of particular interest to me, the conducting system. He was inspired initially by Dr. Otto Safir, the chief of pathology in Chicago, and also invited Maud Abbott to Chicago, where he followed her work closely and with great interest. His medical practice, unfortunately, was interrupted by World War II, where he served in the Army and the Medical Corps before returning to the daily work of medicine. In 1957, he was asked to start a congenital heart disease training institute in Chicago, which he did, and chaired the program for 25 years. He's published on virtually every form of complex congenital heart disease with over 500 papers to his name. Most notably, the first paper in 1937 was described by Alvise yesterday as the transposition of the large arteries, which helped to lead the way to figuring out surgical corrections thereof. Of critical importance, he was also instrumental in describing the conduction system of variations that are seen in ventricular septal defects, tetralogy of Fallot, and atrioventricular septal defects, helping to guide surgeons away from this tissue and saving many from heart block. He also did tremendous work with the electrophysiologists, creating pathological correlations in conduction system diseases. There are multiple mentions in the text of his life that he was a dedicated and gifted teacher, and he would lecture at all 6 of Chicago's medical schools. Dr. Saroja Bharati, a contemporary of Lev's who is singularly phenomenal and internationally renowned as a cardiac pathologist with specialization in conducting system diseases, described that he would, quote, show up carrying a bucket full of hearts even on the coldest winter days, arriving at least an hour before the scheduled lecture. He had a tremendous passion for teaching and made an incredible mark on the field of pediatric cardiology and pediatric cardiovascular surgery. These faces should be well known to most people in the room. As congenital heart lesions continued being described and characterized and discussed, complexities began to arise in the determination of how structure impacts function and how errors in cardiogenesis lead to pathology. It would become clear that a systematic way of describing the heart would be helpful as a tool not only for communication, but also as a source for innovation. By codifying the anatomy, insights to the various disease processes can be revealed, which has led to medical, surgical, interventional, and radiologic innovations. The immense contributions by both the von Proggs and Dr. Anderson cannot be understated. After all, how many times have we heard in lectures or in lecture halls that people in the heart disease, in congenital heart disease fields refer to themselves as Andersonian or von Proggian, lending weight to the magnitude of the contributions of these 3 remarkable individuals and the impact that they had in facilitating the complex discussions of congenital heart disease. Finally today, I'd be derelict in my duty as a cardiology trainee at Sick Kids if I didn't give some special mention to Dr. Bob Freedom. Dr. Freedom made tremendous strides in pediatric cardiology with his research in all areas, from angiocardiography to clinical outcomes work to anatomy and morphology. His passion was for pulmonary atresia with intact ventricular septum, of which his papers are still considered to be the major authoritative work, in which he describes the variety and diversity of presentations of this interesting disease, as well as the pathological and surgical considerations in order to make sure these children do as well as humanly possible. Dr. Freedom's understanding of the role of morphology and understanding physiology and function allowed him to provide highly valued insight to his medical and surgical colleagues, even involving him being called into the operating theater when parts of the anatomy were unclear, in order to provide some guidance to the surgeons on their ability to manipulate the anatomy to the patient's best benefit. He's been instrumental in improving the outcomes of children all across Canada at the Hospital for Sick Children, and is responsible for training an enormous number of individuals over his tenure at the Hospital for Sick Children. And his impact is still being felt to this day. A truly remarkable man and sorely missed. So where to next? Understanding cardiac morphology has been critically important to the development of our field. It's been responsible for understanding of structural anomalies, pathophysiology, embryology, and is responsible for helping us develop ways to treat or palliate the consequences of abnormal cardiogenesis. The field of morphology has been constantly evolving, and has been growing at exponential rates. And just as a point of comparison, Dr. Lev's first paper in 1937 was entitled Transposition of the Large Arteries, providing an anatomical and pathological description of this one particular disease. And most recently, his final paper in 1994 was entitled Pulmonary Valve Eccentricity and Detransposition of the Great Arteries and Implications for Arterial Switch Operations. So in 60 short years, we have seen enormous strides in the depth and the breadth of pathological discussion and what we've been able to accomplish as a field. More is being discovered every year with the advent of new technologies, techniques, and close reanalysis of structures and features is relevant to keep our understanding up so that we're always working with the best possible available morphologic information to make the best decisions for our patients. And what's clear to me is that the more we learn, the more we realize we have to discover. So I will leave you with some final words from Oscar Wilde, one of Dr. Freedom's favorite authors. Thank you so much for listening. And the final words I'll leave you with this morning are, there's only one thing in the world worse than being talked about, and that's not being talked about. So today I wanted to give you guys the opportunity, or you folks, the opportunity to hear a little bit about the lives of the people who are behind some of the major discoveries and major advancements in morphology within our field, so that we can understand that those people, there were real people behind the discoveries that they made, and their impact can't be forgotten. So thank you very much. I open the floor to discussion in the last couple of minutes, and I hope you all have a wonderful day.
That was terrific. Kudos to that presentation. Bob Freedom was my mentor, and if it wasn't for him, I wouldn't be here. He enticed me back to Toronto. It wasn't very difficult, but it was because of him. Just one other note, Dick Van Praagh and Stella were fellows here at the Hospital for Sick Children, and Dick Rowe, who was the chief many years ago, introduced them together. So he was their matchmaker. So there's a tie for morphology here at this hospital. And Dick Van Praagh's first paper on single ventricle was written while he was a cardiology fellow. And he had driven all over North America picking up these specimens during his fellowship. So most of his time was spent driving around in a car. And Dick Rowe was very disturbed by the whole, actually John Keith was very disturbed by the whole thing because his fellowship was really spent outside of the Hospital for Sick Children. There's this story, and I don't want to belabor this, but there's this story that he had all these specimens in the formaldehyde buckets in the trunk of his car, and he was driving over the border at Windsor, and the border person, whoever was, asked him to open up his trunk, and he opened up the trunk, and the border guard looked down, and there were these vats of about 25 different hearts, all single ventricles. And Van Praagh has this very unusual laugh when he's under stress, and he tells the story that he started laughing, and the poor border guard was so confused about what was going on, he said, "Just go."
Very good. Thanks very much, Michael. That was a really entertaining and informative lecture. Thank you.
I have a quick question, a quick comment as well. Dr. Benson mentioned about Dr. Van Praagh. I don't know if you guys know, but Dr. Helen Tausig also has an interesting story. She was already like at end of life. She was living in somewhere that has a lot of birds, dead birds, because of the electricity. So she started studying the anatomy, compared anatomy with the birds and single ventricles, because of she was seeing those dead birds close to home. This is also interesting story about.